Hey everyone, it's Dr. Mike. Today, we're diving into CNS Pharmacology. CNS stands for Central Nervous System, which includes your brain and spinal cord. This system controls everything you do, from thinking and feeling to breathing and moving. Imagine your CNS as a network of roads and highways. Information, in the form of electrical and chemical signals, travels along these pathways. When you touch something hot, a signal shoots from your hand to your brain, telling you to pull away. That's your CNS in action. Like any complex system, things can go wrong with the CNS. That's where CNS pharmacology comes in. It's the study of drugs that affect the CNS, treating conditions like pain, anxiety, and depression. Let's explore these medications and how they work. Let's face it, nobody enjoys pain. Whether it's the sharp sting of a needle or the throbbing ache after surgery, pain can really put a damper on your day. That's where local anesthetics come in handy. These drugs work by temporarily blocking nerve signals in a specific area of your body. Think of it like this. Imagine your nerves are like telephone lines carrying pain messages to your brain. Local anesthetics are like those annoying telemarketers who interrupt your calls. They block the pain signals from getting through, numbing the area and preventing you from feeling discomfort. Local anesthetics are commonly used for procedures like dental work, minor surgeries, and even childbirth. They can be administered through injections, creams, or patches. Some common examples include lidocaine, which you might recognize from the dentist's chair, and bupivacaine, often used for longer procedures. Ever feel like your mind is racing a mile a minute? Or have trouble quieting your thoughts before bed? Sedatives and hypnotics are medications that can help calm your brain and promote relaxation or sleep. Think of sedatives like dimming the lights in your house. They take the edge off anxiety and make you feel more relaxed. Hypnotics, on the other hand, are like turning off the lights completely, inducing sleep. There are two main types of sedatives, and hypnotics: benzodiazepines and non-benzodiazepines. Benzodiazepines, like diazepam, Valium, and alprazolam, Xanax, work by enhancing the effects of a neurotransmitter called GABA, which has a calming effect on the brain. Non-benzodiazepines, like zolpidem, Ambien, and azopiclone, Lunesta, target different receptors in the brain to promote sleep. Anxiety is a normal human emotion, but for some people, it can become overwhelming and interfere with daily life. That's where anxiolytics, also known as anti-anxiety medications, come in. These drugs help reduce anxiety symptoms like fear, worry, and panic. Imagine your anxiety as a loud, obnoxious roommate who just won't quit. Anxiolytics are like noise-cancelling headphones that help muffle the volume and restore some peace and quiet. Several types of medications are used to treat anxiety, each working in slightly different ways. Benzodiazepines, like those mentioned earlier, can also be used for short-term anxiety relief. Selective serotonin reuptake inhibitors, SSRIs, like escitalopram, Lexapro, and sertraline, Zoloft, are commonly prescribed for longer-term anxiety management. They work by increasing levels of serotonin, a neurotransmitter that plays a role in mood regulation. Another option is buspirone, Buspar, which acts on different brain receptors than benzodiazepines or SSRIs. Section 5. Lifting the fog. Understanding antidepressants. Depression is more than just feeling sad. It's a serious medical condition that can affect your mood, thoughts, behavior, and physical health. Antidepressants are medications that help alleviate the symptoms of depression. You can think of depression like a chemical imbalance in your brain. Neurotransmitters, those chemical messengers we talked about earlier, play a crucial role in regulating mood. In depression, levels of certain neurotransmitters, like serotonin, norepinephrine, and dopamine, may be out of whack. Antidepressants work by adjusting these levels, helping to lift the fog of depression and restore balance. Several classes of antidepressants are available, each targeting different neurotransmitters. SSRIs, like fluoxetine, Prozac, and paroxetine, Paxil, are commonly prescribed first-line treatments for depression. Serotonin norepinephrine. Reuptake inhibitors, or SNRIs, like venlafaxine, Effexa, and duloxetine, Cymbalta, increase levels of both serotonin and norepinephrine. Tricyclic antidepressants, or TCAs, like amitriptyline, Elavil, and imipramine, tofranil, have been used for many years but are not typically prescribed as first-line treatments due to potential side effects. Monoamine oxidase inhibitors, or MAOIs, like phenelzine, Nardil, and tranylcypromine, Parnate, are another class of antidepressants reserved for cases that haven't responded to other medications due to potential interactions with certain foods and medications. Section 6. Navigating Psychosis. A look at antipsychotics. Psychosis is a serious mental health condition that affects a person's perception of reality. Individuals experiencing psychosis may have hallucinations, delusions, or disorganized thinking. Antipsychotic medications are used to manage these symptoms and help people with psychosis live fulfilling lives. Imagine your brain as an orchestra, with different sections playing in harmony. In psychosis, it's like some instruments are out of tune, creating a cacophony of sound. Antipsychotics work as conductors, helping to restore order and harmony. Antipsychotics are divided into two main categories: typical and atypical antipsychotics. Typical antipsychotics, like haloperidol, Haldol, and chlorpromazine, Thorazine, primarily block dopamine receptors in the brain. Atypical antipsychotics, like risperidone, Risperdal, olanzapine, Zyprexa, and quetiapine, Seroquel, act on both dopamine and serotonin receptors. While both types effectively treat psychosis, atypical antipsychotics are often preferred due to their lower risk of certain side effects. Section 7. Short-circuiting seizures. Anti-epileptic drugs. Epilepsy is a neurological disorder characterized by recurrent seizures, which are caused by abnormal electrical activity in the brain. Anti-epileptic drugs, also known as anticonvulsants, are medications that help control seizures by stabilizing electrical activity in the brain. Think of your brain as a complex electrical grid. Seizures are like power surges that disrupt the normal flow of electricity. Anti-epileptic drugs act as surge protectors, preventing these surges and keeping the electrical current stable. There are many different types of anti-epileptic drugs available, each targeting specific mechanisms in the brain to prevent seizures. Some common examples include phenytoin, also known as Dilantin, carbamazepine, known as Tegretol, valproic acid, or Depakote, lamotrigine, which you might know as Lamictal, and levetiracetam, or Keppra. The choice of anti-epileptic drug depends on the type of seizures a person experiences, their medical history, and other factors. Section 8. Neurodegenerative diseases, Parkinson's and Alzheimer's. Neurodegenerative diseases are a group of conditions that cause progressive damage to nerve cells in the brain, leading to problems with movement, thinking, and memory. Parkinson's disease and Alzheimer's disease are two of the most common neurodegenerative diseases. Imagine your brain as a library filled with books containing all your memories and skills. Neurodegenerative diseases are like bookworms, slowly eating away at these books, making it harder to access the information within them. While there is currently no cure for Parkinson's or Alzheimer's, medications can help manage symptoms and slow disease progression. For Parkinson's disease, medications like levodopa and carbidopa, known as Sinemet, and dopamine agonists like pramipexole, also called Mirapex, aim to increase dopamine levels in the brain. which are crucial for movement control. For Alzheimer's disease, cholinesterase inhibitors like donepezil, known as Aricept, and memantine or Namenda, can help improve cognitive function and memory. Section 9. Pain relief. Narcotic and non-narcotic analgesics. Pain is an unpleasant but essential sensation that protects us from harm. When we experience pain, our bodies are sending a signal to our brains that something is wrong. Analgesics, also known as painkillers, are medications that relieve pain by interrupting these pain signals. Think of pain signals as messengers traveling from the site of injury to your brain. Analgesics are like roadblocks that intercept these messengers, preventing them from reaching their destination and reducing the sensation of pain. Analgesics are broadly classified into two categories: narcotic and non-narcotic analgesics. Non-narcotic analgesics, like acetaminophen, commonly known as Tylenol, and non-steroidal anti-inflammatory drugs, or NSAIDs, like ibuprofen, known as Advil, and naproxen, or Aleve, are commonly used for mild to moderate pain. Narcotic analgesics, also known as opioids, are more potent and are typically reserved for moderate to severe pain. Examples of opioids include morphine, oxycodone, also known as OxyContin, and hydrocodone or Vicodin. Section 10. Conclusion. The importance of CNS pharmacology. Understanding how drugs interact with our central nervous system is crucial for developing effective treatments for a wide range of neurological and psychiatric disorders. CNS pharmacology is a complex and constantly evolving field. But by understanding the basic mechanisms of action of different drug classes, we can better appreciate the potential benefits and risks associated with their use. As with any medication, it's essential to talk to your doctor about the potential benefits and risks of CNS drugs before starting any new treatment regimen. Remember, this information is not a substitute for professional medical advice. If you have any concerns about your health, always consult with a qualified healthcare professional. Stay happy and healthy. This is Dr. Mike signing out.